Well, we're back with Dr. Carlson. Dr. Carlson, we talked about that people need orthotics sometimes, in many cases, in order to make sure their foot is somehow straight in whichever way it might possibly be crooked, in order to have the rest of the body aligned, which otherwise gets to back pain, knee surgery, and headaches and all kinds of stuff. Now, would, a person with, let's say, a bunion, those little things which hurt when you put your shoes on it and you cut. My father, every shoe he bought, the first thing was go and cut a hole where one or two of his bunions were. Wouldn't, when one has pain, wouldn't one automatically start moving funny? Because, when you have pain, you don't want to touch it. Wouldn't you twist your leg right away and actually achieve the same bad misalignment in the body if you don't get this little pain fixed?
Absolutely. What happens is what we call that in a medical term is guarding. If a patient has either heel pain, bunion pain, any kind of foot pain, what they do is they actually guard, or they try not to walk correctly or shift their weight slightly to alleviate that area of pain. And when they do that, what happens is they actually, again, throw off balance, their ankle, their knee, their hip, the lower back, further up the back, and that, by doing that, that causes pain in other areas. So from something simple like just shifting your weight because your bunion hurts can lead into more problems such as knee, lower back, hip pain.
Right.
So that is true.
It's like when you have, I remember in the army, when you have a blister, and I was in a medical unit and I treated lots of people with blisters. Obviously, they start walking crooked like crazy. Now, a blister is one thing; it goes away after a couple, 2-3 days, and it's no big deal. I think any body, any knee, any hip can manage that. But a bunion, it doesn't really go away except if it be treated. Am I right there?
Yes, the bunion, the deformity doesn't go away unless it is surgically treated. You have to realign the joint. But if you do use a custom orthotic, you can make a modification in that, number one, to prevent the deformity from progressing, and number two, you can actually make a correction to alleviate some of that pain in the joint. So if a patient is not ready to have a surgical correction or is unable to take the time off or is not a candidate, there is something that can be done with an orthotic to help alleviate their pain, correct the way they walk, and stop this problem from getting worse. So for a patient, that's a great benefit. They can prolong the surgery and be comfortable and be able to walk without throwing anything else off of alignment, such as your knee, your hip, your lower back, your upper back, and so on and so forth.
I see. Well, that's interesting to hear. So basically, an orthotic, if you don't want to do the surgery, still would at least help correcting the problem you're creating with it. If for some reason you don't want to do it or cannot do it. Are there any other treatments for bunions rather than surgery and orthotics?
Yeah, we actually do some pain relief, which we could do some injections into the joint. Many people have had tennis elbow or problems with their knees where they've gotten steroid injections and gotten relief. That is something we do in the big toe. We also do physical therapy, which also helps with range of motion exercises and different modalities to help get rid of the inflammation that's there. Because we all know that inflammation triggers pain, and that's where pain comes from, inflammation. So those are some of the other things. And then, of course, there's your usual medical treatments with some kind of anti-inflammatories or pills to help you feel better with that, too.
Not to forget the hole in the new shoe.
Yes, the new shoe. A new wider shoe that's more comfortable.
and cut out a hole.
Right, the shoe manufacturers will like that.
Yeah, I mean, somebody's going to come up with that idea and charge a couple $100 more for it, right?
Right.
Yeah. Well, all right. That was very informative, Dr. Carlson. Thanks a lot.
You're very welcome, Helmut.